Good afternoon, everyone, and welcome to the 16th episode of Genomics Gupshup. This is where we bring in renowned experts in the field of genetics and close by people who do use genetics to explain to our viewers how to simplify the whole concept of genomics and genetics and make it part of our regular conversation. And today we are delighted that we have somebody as renowned as Dr. Puja Grover Kapoor, who runs Continue of Care, but is also a consultant at Paras Hospital. Welcome, Dr. Puja. We are delighted to have you here.
Thank you so much. Thank you. Thank you for the invite. It's a pleasure.
Thanks, Dr. Puja. We'll start off with a simple question on just what got you excited about the whole medical field and why did you become a doctor?
So basically, I owe everything to my parents and to my teachers. So, I got attracted towards biology because I could recall that my biology teacher made biology so interesting that I really lost interest in all the subjects and really got attracted towards one of the subjects. And later I realized that with biology, the options are very less. And so I landed up becoming a doctor. And then in my first MBBS years, again, the teachers just made it so fascinating, learning about the human anatomy, physiology, learning about the things that I really got into know. I really have to become a doctor because the things are so fascinating. But the ignition was done definitely by my initial years teachers and by later year teachers. And same hold too for my pediatric neurology, because I was doing pediatrics under Dr. Gauri Rao Pasi. She's an Amsonian, and we could see like she was very much interested in neurology, pediatric neurology. And I said, no, this is the way out. And she made everything so interesting that today I owe everything to my teachers, wherever they are. A big salute to all of them.
That's awesome. I guess we just had Teachers' Day, and I think they'll be delighted to see that they're the ones who got you there. Is your family also in medicine or not?
I am the only doctor in the family. That's what I said. I have no connect with the so-called doctor things. And after I took medicine, so my brothers, I have like two younger brothers, and both of them like, no, it requires a lot of reading, and so we are out for that. So I'm the only one left, pre and post generation of mine with a doctor degree.
But I mean, pediatric neurology is very interesting and probably a very difficult area as well, right? So why did you choose pediatric neurology? Because I'm sure a lot of people reach out to you all the time.
So the thing is, like, I got pediatrics. I was doing pediatrics, and then I practiced pediatrics for 2 years. But then I wanted to do something different. And then my teacher was there who showed me the way out, that beyond pediatrics also there's something. And that point of time, it was in 2019 somewhere, when everybody was going in for super specializations. And so everything turned into that way. I was not very happy with doing only pediatrics. And that was a way out. People were looking for subspecialties. And then I had a teacher who showed me, okay, this subspecialty had the best of the thing. And so I landed up into pediatric neurology, and I found it too interesting, very interesting. So there I am.
Absolutely. I think there's nothing more fascinating than understanding neurology. And then you're able to help so many children and their parents. So I think it's amazing. But you went to the US for a fellowship, right? To Cleveland. So what was that fellowship about? And do you think that was, do they practice medicine differently from India, or do you think it's about the same?
Yeah. So basically, I did my pediatric neurology fellowship under Dr. Anu Acharya at Just Loke Hospital, Mumbai. And then I really wanted to know what's happening in the world. I really want to do like what is there all about. And so that fascinated me, and to gain in more knowledge and to be very much sure of to learn more, and also to see what is the difference, how people outside the world are working. And that led me to land up at Cleveland. And Then I did fellowship in pediatric electrophysiology, both in EEG and EMG and NCVs.
So to explain to like a regular viewer, I think many people don't even know who a pediatrician is, and now you're a pediatric neurologist. So I think maybe it'll help to understand what is different between both of these two streams in simple language. So,
So pediatric is a doctor who deals with the ailment referring to pediatric age group from 0 to 18 years of age, according to Indian Academy of Pediatrics. So any ailment with a human child, with a child from 0 to 18 years is dealt by a pediatrician. But if you divide the things that to deal only with pediatric brain, a pediatric neurologist came into the picture. So it's something like pediatric endocrinologist, pediatric hemato-oncologist, pediatric cardiology, pediatric orthopedics. Now everything pediatric have been subdivided, and I take care of only the neurons of the pediatric age group. So this is how pediatric neurology is different from the whole pediatrics. So I don't treat simple cough, cold, fever, or anything to do with anything apart from human pediatric brain. That's it.
so people can't just come and call you and say, my child has a fever. But I guess some kinds of fever you do deal with if it is of a specific type, right?
Yeah. Yes. Yes.
All right. So maybe we'll move on. I saw that you had a lot of interest in autism, in epilepsy, in ADHD, and others. But when it comes to autism, it's called autism spectrum disorder. So what is the spectrum really mean over there? Is it because there are different kinds, or what exactly? Why is it called a autism spectrum disorder?
Yeah. So what happened was, till 2013, autism was a different entity, and it has subdivisions from Asperger's and something NOS types. But after 2013, because then there was a lot of variety. So autism is just not present as a single entity with some few symptoms, and if you fulfill that criteria, you become diagnosed as this neurodevelopmental disorder. Because it was from so varied features that they redefined the term in 2013 and then labeled it as autism spectrum disorder. Because few of our children may have sensory concerns dealing only with visual, some may have dealing with some other thing. So, that was a huge diversification. So, and to bring out a unanimous diagnosis of autism umbrella term, they defined it autism as autism spectrum disorder, which entails from something which have got very less communication, maybe verbal, maybe just pointing towards object, maybe not listening to the command, and to a very severe variety where you are just cocooned to one part of the house and you are doing nothing, and you are so busy with your sense organs that you don't do anything and you don't listen to any command. So that was a big spectrum, and so that's why the labeling come as autism spectrum disorder and not just simple autism as such.
And do you think autism spectrum runs in families? Is there something genetic about it? And if so, how do you, can you, and do you test for autism?
Yes. So in 2020, American Academy of Pediatrics came with the guidelines of the diagnosis of autism. And in that, they have put a very big emphasis on the genetics. So genetics involved, because they found out that 30% of the children with autism, diagnosed with autism, have some or the other genetic phenomena. Maybe it could be Fragile X genetics, maybe some could be picked up by microarray, some may be picked up by whole exome sequencing. So they have labeled it by doing all these 3 genetic testing. And they found out by doing this, they found out that 30% of the children with autism spectrum disorder could have some clue or the other in the genetics. And that is why now with the 2020 guidelines coming in, genetics has come up in a big way in the diagnosis of autism spectrum disorder.
And typically, I think what percentage of the patients would actually do a test? Let's say even if they know that this might help them, do they actually do it? I guess more likely if the doctor tells them, but
yeah. So it is our duty because the guidelines have come in, and that too 30 to 40% is a big number. So obviously we open up them the option, we tell them the option of that there could be, this is a genetic predisposition is there. And I've seen like all those who have got their first child as autistic child diagnosed as autistic, they really are interested because they want to know whether the next pregnancy could also have the same concerns. And also they want to really find out the diagnosis or where the genetics went wrong. And to be very frank, if the second or the third child is there who's got diagnosed with autism and they are not planning for another sibling, they say, okay, let it be. And they, despite of telling, they are not interested in the diagnosis. They say, okay, despite the diagnosis, the treatment protocol remains the same. And because they are not planning for further pregnancies, they say, okay, we'll let it go like that because maybe of the expense or maybe because the treatment protocol remains the same despite knowing what the genetics is. So they choose not to do the genetics.
so will an autistic child, when they have children also, would it be recommended at that time for them to do it, or?
Oh, definitely. That is for the 100% people. Yes.
And
Yes.
when would be the other cases that genetic testing would be recommended? You mentioned that if it is somebody who has a child already, is there any other case where people suspecting of autism?
Yeah. Yes. So if you have been like, you have large ears, you have hypotonia, you have neurocutaneous marker, you are a bit dysmorphism is present, you have joint laxity, you have hepatosplenomegaly. So there are plethora of symptomatology which tells us no, in this child though, you have to do genetics. And maybe the autistic features are secondary and there are other features in the form of global developmental delay. The cognition part is not age appropriate, which tells us that we have to do the genetics because there are high chances that we will pick up something other than genetics, which could be treated in a different way. And also definitely it helps you give the child the diagnosis and for the future pregnancies, for the prevention of having the same child in the next pregnancies. So I have like 2 children from Nigeria who were diagnosed with Fragile X. So like if the first child would have been diagnosed, if the genetics would have been done, then the second child we would have saved, So look at the parent, the agony of the parent who has got 2 children with Fragile X genetics and both autistic and both having the same things. So definitely that could have very well be prevented if we would have done the genetics in the first. And the second sibling would have been definitely be prevented from having the same concerns. So yes, genetics do have a major role. Once we suspect if there are certain concerns in the child, apart from just the autistic symptoms, if we have, as I described, the other symptomatology, then definitely you have to do the genetics because we have 3P deletion. We have so many other conditions where you can definitely prevent the other sibling to be not the same, and we could get a better future for the further children.
So I'm sure you get a lot of patients who have, autism spectrum disorder. But when you look at the prevalence in the Indian society, is it relatively common? Is it something that you feel is a fairly rare thing, or do you think it is quite common and every person, every parent, or everybody, expecting a child should at least be aware of how to actually look at the consequences of that as well? So how common or rare is autism spectrum?
Mine is a very niche subspecialty where I just deal with neurology exclusively. So, with me, it is very common. So every third child requires genetics because it may be because of the dysmorphism, it may be because of the autism, it may be because of the other myopathies or this. So for me, because I a population who has certain concerns with neurology. So definitely, for me, that's a very common scenario. For every third child, I require genetic testing to be done to find out the cause. Definitely. We have metabolic disorders, we have genetic disorders, we have so many familial diseases, we have so many epileptic encephalopathies, which are genetic. So definitely, for me, this is very common. Yes, if you ask from a pediatric perspective point of view, then obviously there's so many other things that for them, they become a rarity. But for me, this is a very common.
And since you mentioned that, I mean, obviously you're a pediatric neurologist. Most people coming to you are coming with a specific problem that is there. So is there a possibility that if parents are more aware, that they can actually prevent a lot of the childhood neurological problems? And do you think currently our awareness levels in society are fairly limited at this point of time?
Look, to be very frank, when I joined pediatric neurology, the awareness was even lesser. Now I'm really excited because people are at least knowing about it. If I tell about the genetics, they know about it. Okay, this could be done. And to my surprise, like seriously, people are coming with, can I do some genetics on that? So they are becoming aware, but definitely, yeah, this is only localized to only Gurgaon or basically NCR or something metropolitan places. But in the deeper places, yes, they are still unaware. And a lot has to still be done. So, these Gupshup-like platforms need to be there and make available for the general population also to understand, yes, that tests like these do exist and they will help to get a better future for our children and obviously for the next generation too. So, yes, we require still more effort, but yes, the previous efforts by our seniors has still not gone wasted because we could see that awareness is increasing.
तो हिंदी में भी गपशप करनी चाहिए.
हिंदी में भी गपशप करनी चाहिए और बहुत ही सेंसिबल टॉपिक पे, नॉट ऑन नॉनसेंसिकल टॉपिक. सो लाइक ये गपशप जरूरी भी है, ये वाली गपशप जरूरी है.
And what do you think is the most commonly used genomic test currently that maybe you use or other pediatric neurologists would use? Because there are obviously many kinds of genetic tests, right? There's regular.
So, yeah. So the most commonest one is like the whole exome sequencing and chromosome microarray. Basically, these two are done now very frequently by pediatric neurologists all over the world. And those have picked up and the results are very good. So obviously those tells us, once you get the diagnosis, you feel so elated that you would be able to help the child who's come in agony and the parents who are so frustrated. So like, yes, these two tests are helping us in a very good way and giving us solutions, giving us answers to the questions which were unanswered maybe a decade before.
And so what about Sanger sequencing? Because you mentioned a lot of fragile X testing as well, right? Is that, but I guess maybe not as common anymore because I think overall the cost ends up becoming a little bit higher when you're looking at multiple genes versus an exome sequencing whose prices now come down quite dramatically, right?
Yeah. So yes, we do Sanger sequencing, although we are suspecting very strong suspicion of a single gene disorder or where the gene is not very heavy. So definitely we ask for Sanger sequencing, but if still we are in doubt and we are suspecting multiple XYZ diagnosis, then obviously we go for the whole exome. So depending on what the criteria is, how does the child tell us? If it's we are straightforward to the point diagnosis, yes, this is only 1 point single diagnosis, then, and we have very high clinical suspicion, then Sanger is the testing of choice. Whereas if we are in a dilemma, we have multiple choices, we have multiple clinical features and we are not able to pinpoint exactly the diagnosis, then whole exome comes in a better way.
So clearly, I think not all of them will be same. Every case will be slightly different. But are there relatively common genes like the FMR1 or something that you feel are something that you would look at for, in the beginning, and then maybe there are other things that are there. But are there some that you have a doubt on whenever you look at a child? Are there 2-3 genes that you feel some areas.
So, yeah, obviously. So, the whole exome sequencing without the clinical information and without the differential diagnosis is nothing.
Absolutely.
Actually, it's like andhere mein teer marna. It's like, no. It should not be like andhere mein teer marna. It should be very well. So before we give in and go for the whole exome sequencing, we know what we are doing. We know the differentials. We tell them, okay, please closely look for these genes, and then we conclude. In fact, even after the report, we discuss that, okay, are we fitting up into these? Because sometimes VUS comes in, sometimes the clinical things are not fitting into the diagnostic or the genetic workup which we have done. So, that's a lot of brainstorming. Just writing down whole exome sequencing obviously is like nothing. You have to have a very strong clinical history. You have to have apart from the genetics, what is your MRI finding? What is your TMS, GCMS finding? Is ammonia was high or lactate were high? What you are looking in for? You're looking in for urea cycle defect, and what gene you are actually looking in for. That helps the person who's sitting on the other side of the table and who's looking for all the genetics. That really helps the person to find out. So definitely whole exome sequencing is like lame without the clinical diagnosis, without the inputs from a doctor. It is basically two people working together for the same cause. You have your own specifications, and I am giving you my specifications. And the point at which they meet gives you the diagnosis to the child, and that is what is helpful for the patient. Naito, if I work on my own lines and write down, and you work on your own lines, not going to help the child in any way. Because it's so huge, it's an ocean, and you're looking in for a pin over there. So without the correct localization, you just cannot search up and get to a conclusive diagnosis. Definitely.
I always have this discussion, especially with our team, why that is so important, because you have so much information. If you don't have good clinical history, our genetic counselors are there to be able to help understand if there's something that we can. But if you just someone says, I want a whole exome sequencing, yes, you can get the data, but if you need a diagnosis, that without the doctor.
Yeah.
You cannot do it without the information that comes in with the history and all of that. And I think that's a extremely important aspect to looking at. Any diagnosis is not done independently either by a geneticist or a bioinformatician or the doctor. So all of that, everybody has a role to play in it.
Yeah. So even without, we were taught about, if you're ordering for any investigation, you should keep in your mind what it could come out. Even for an MRI, before writing an MRI, we think about, okay, what would be the differentials and where we are looking in for the signs? Are they clinically correlating or not? Definitely. Even every investigation, it's just a supportive finding to your clinical findings. So without clinical diagnosis, your genetics or even an MRI or anything is of no use if you don't have the thing in your mind that why are you doing that investigation for, and what's the purpose of that investigation.
So I loved your videos. I did go through many of them, and in one of your videos you mentioned that autism and epilepsy are relatively strongly correlated. That there is a stronger prevalence between the two. So what causes that, and why is that the case? And should parents be concerned and come when they have either one or the other to understand?
Yeah. So basically, autism also has something to do with the structural thing in the brain, and epilepsy too. So there's a 30% chance in a child who's got autism that then the common journal normal so-called neurotypical children to have a seizure or epilepsy basically. And yes, they are there. And right now we are still working on the clinical and the genetics part of it. But slowly, yeah, we are finding out the ways of us. But if you ask me right now, today, are there any genetics correlation? So no, we haven't still found out very specific genes. But yes, it is coming up. And maybe after the data is collated of years of working on this, we would be able to conclude on something. But still, we are halfway done on that part of it. It's still a lot of work needs to be done.
Dr. Puja, you learned a lot of genomics and genetic testing over the years, but not everybody is at the same level as you, right? How do we get more medical doctors to sort of join in this genomic revolution, as they say? What can we do? Is there some way that we can make it easier? Because clearly, I think there are many more things that you do other than genetics, right? So how do we get more doctors to become aware of genomic testing?
Look, you have to talk to the doctors because, you know, until unless you realize the importance of the test, you are not going to write that for them. Okay. So until unless, in the previous years, it was very expensive. And so the prohibitory factor was that it's a lot of cost. And even if it comes negative, we are nowhere. After making the patient spend so much and you're still inconclusive, you feel like, what is this happening, man? And now with the test cost coming so low, it's becoming it's something easier test, and availability also has increased. A lot of people are doing it. Previously, it was very less people were doing it. So I think it's the awareness among the journal doctors to tell them about the importance of the test. Look, if we did this and we were able to prevent another pregnancy with that. So like, as I give you the example that I had two children from Nigeria who had fragile eggs. So that is such a clear-cut example that in the first pregnancy, we would have diagnosed that with the genetics. I would have prevented a whole life of sufferings, of so much depression in the parents. People coming from Nigeria, flying all over and knowing, oh, this could have been prevented. Just look at the misery. We're dealing with a live human being. It's not an electric fan and then you replace it with another one, or a television which got wrong and you replace it. So it's a life, and everything becomes so disturbed. Look at the parents' life. Everything becomes so depressing, and you have to work hard for your children and the results are not getting good. You're asking for our children who are getting for ITs and IMs, and there are children who are just faltering on even to get to the normal school. So so that could be prevented. So if you get to this pediatricians or all the general doctors to know about the agony, I think that would really help them to connect and then find out, and they would be able to prescribe and write down this genetic test in a more easier and earlier way, and so that things could be detected early and more frequently.
So other than autism spectrum disorder and epilepsy, what are the few other neurological conditions that typically I think you see in your clinic or your very hospital?
Dystrophies, all the muscular dystrophies. So recently we had a child whose elder son was having DMD, got it genetically confirmed, and then she conceived with the amniocentesis. The other child also had the same thing, so we got her aborted. Just again, if this child would have come into the life, like we knew the future that he would not live more than 15, 20 years. So the two children going for just 20 years of survival rate and then bed bound. So yes, so DMD, Duchenne muscle dystrophies, all the dystrophies, basically, all the myopathies, all the metabolic disorders. So today I saw like one mucopolysaccharidosis. So we're going in for the testing for that so that we could be able to prevent the next pregnancy. So all the metabolic genetic disorders definitely have to be done through the genetics, and the matter has to be resolved so that we don't land up into another child who have the same symptoms. So there's a huge list, huge list.
And I think it's a great thing that now I've also seen that the government has now started these Nidan Kendras, at least like creating that the whole awareness in the in the population that these are things that maybe you could have prevented before if you knew, or at least even an intervention many times after the child is born as well. So I think hopefully the awareness levels will increase, and we are glad that we have people doctors like you who are aware and understand genetic testing, and I think that combination of medical and genetics is what's going to help help the population in general. So I know, is there anything else you would like to talk about, or we will go to the rapid fire question after this?
So I think awareness is the key now. We have to work on the awareness part of it. That's the most important take-home message is the more aware we are, we would be able to prevent it, because prevention is definitely better than cure. And there are certain diseases which do not even have a cure. So yes, we have to work harder for the prevention, and so that we have to spread awareness. That's the only thing which we have in our hands.
And as a thought, I know we mostly talk to you about exome sequencing and clinical sequencing and all of that. But what are your thoughts also on just complex disorders? Where you can, with lifestyle changes, make those changes. You know.
Yeah. Yeah. So that again have to be. I mean, a lot of work has to be done for them also. A lot of work has to be done. A lot of awareness has to be created for them also. So single gene Mendelian disorder, this complex. There's a lot of things to be done. But I think to start with awareness, I tell you again, like when I started practicing, this much awareness was also not there.
Absolutely.
I mean, I talked to doctors. Yeah, they know about, at least there's something exists now. But that is so good. So I'm happy about with this small development also. And I think with this, we can grow up step by step, inch by inch, and we would be able to reach where we want to.
Absolutely. I think you are a genomic pioneer, as we call in this space. And we hope that, you inspire many more medical doctors in being able to use these technologies that are there. Let's start the rapid fire question. So what is your favorite book or a movie?
Godfather.
Oh, interesting. Very interesting. I'm not going to ask you why, but if you want to, you are welcome to explain.
No, I really like the character. I am much like that character.
Yeah, absolutely. So if you didn't become a pediatric neurologist, what would you have wanted to become?
Nothing, it's that I think I was born to become a pediatric neurologist. Seriously, I cannot think of anything else. I just cannot think of anything else.
Are you a morning person or a night person?
Morning, 4 a.m.
Wow, early morning, 4 a.m. or 5 a.m. Yeah, that's amazing.
Yeah.
Given that you are a pediatric neurologist, I don't know if you actually had any worst subject in school or college, but was there any subject that you absolutely did not like?
So my mathematics was 0, My addition still is at pathetic state of affairs. I use finger counting still. So mathematics is my gray area. My neurons don't work on that. Numbers is for me.
I think everybody has something that they don't, and then there are subjects that we all love. So
yeah.
So I think with that we'll conclude the rapid fire and our Gupshup for today. I hope you enjoyed this new version of the Gupshup with the immersive background. And we hopefully can, if you come to Hyderabad, meet you there or in our Delhi lab. We'll be happy. It would be great to meet you or in your premises or in our labs. But it's been a pleasure and an absolute honor to have you on the Genomics Gupshup. And thank you for being, such an amazing medical doctor who has saved so many children and parents of agony that they otherwise would have gone through. So thank you very much and appreciate all the work that you do and hope to meet you in person sometime. Thank you.
Thank you so much. I too had an interesting talk with you. Thank you so much.
Thank you.